Hello, my name is Tara Leslie, and I'm the course coordinator for Pharm 515. By the end of this short video, you as a preceptor will be aware of the course objectives and the student assignments in Pharm 515. You'll be able to access student assessments and apply the assessment procedures for your Pharm 515 learner. You'll be comfortable with the preceptor role and the responsibilities in the course, and aware of how to access additional resources applicable to Pharm 515 preceptors. Let's get started with an overview of the course. Pharm 515, previously known as the Specialty Elective, is a student-developed 240-hour experiential education course. The practice area can be in any professional setting within the scope of pharmacy and is selected by the student based on their own professional interests. Pharm 515 can be in a focused patient clinical area, such as an HIV clinic or a travel clinic, or it can be in non-direct patient care, such as research or drug information, leadership, or maybe a professional association, or it can be a combination of some patient care activities and some non-direct patient care activities, such as a clinic a couple of days a week with some project or research time. The schedule is also quite flexible. Most students choose to do the placement as a full-time 6-week course. However, students can extend the duration of the placement with less hours per week or with intermittent breaks. Whatever the schedule, though, it must be agreeable to you, the preceptor, and it must be appropriate for the environment. A setting that has daily rounds or daily meetings would likely not work all that well for a part-time basis placement. But a research project that has various longitudinal steps often is very appropriate for a modified schedule. The course outcomes are listed here for you. You can see that they are framed to provide flexibility for the practice. Regardless of the practice setting, students are expected to demonstrate competencies of professionalism, communication, collaboration, being self-motivated, and integrating critical thinking. For collaboration, how this might look is quite different depending on the practice setting. A student may be collaborating with a large team, or may just be collaborating with you as a partnership in a 2-person team. Other objectives can include competencies related to patient care, maybe scholarly or research skills, or other things that are applicable to the setting. Students will have the opportunity to develop their own learning goals for the placement in consult with you, the preceptor. I'll dig into this further a few slides from now. There are 2 mandatory student assignments for this course, which I will review in this session. You and the student can also work together to determine additional assignments for the placement. These assignments should be challenging, but realistic for a 240-hour placement. In addition, they should offer valuable learning opportunities that align with the practice setting. The first mandatory assignment for this course is called the placement proposal. Using a template I make available to the students, each student is expected to submit a placement outline that includes general information, the schedule, and a learning plan. The learning plan is the bulk of the assignment, and it requires the student to develop learning goals, identify strategies to meet their learning goals, and some progress indicators. Approximately 4 to 6 weeks before the placement, the learner will reach out to you, seeking input or feedback into the specific activities they will be involved with or assigned. Then approximately 3 weeks prior to the start of the placement, they will submit the placement proposal to me. Here is a screenshot of Part A and B of the template. In the first part, the student provides the details of the preceptor and the practice setting, as well as a brief overview of the placement. In Part B, they indicate the schedule. The student will select standard schedule if the Pharm 515 will be on a full-time basis in a regular placement block. But they'll choose modified and elaborate appropriately if the placement is being completed on a part-time basis, or if there's any breaks of 1 week or longer within the placement. In Part C, Students outline their learning goals in the first column. For each of the learning goals, they'll map out strategies and resources that they will use or engage in to meet their goals. This may include outlining some readings, maybe some activities, or some projects that they are going to undertake to gain knowledge or develop the skills within their learning goals. So for example, a student may be very keen to learn about teaching. Taking this idea and formulating it into a SMART goal may lead the student to write something like, by the end of the third week of my placement, I will have developed an organized process of creating and delivering educational content to meet predefined learning objectives. The strategies may be to clarify the learning session and the objectives, to review the literature on the topic, create a slide deck that addresses the learning objectives, deliver the lecture to students, and then develop assessment questions to determine if the objectives have been met. The third column of the placement proposal or of the learning plan is indicators of progress. This is where students will outline the way in which they will measure their progress. Examples might be the ability to meet appropriate deadlines, feedback from my preceptor, or maybe some self-reflection exercises, or even some more formal evaluation strategies. The last two columns are for the student to self-reflect during the placement. After 120 hours, or at the midpoint of the placement, students are asked to jot down their thoughts and their progress so far. At the end of the placement, again, students are asked to write down some reflective notes for their progress throughout the placement. In Part C, the students are outlining their learning goals and the associated plan. In Part D, students need to think about which of their learning goals from Part C may be a nice fit for their continuing competence portfolio. In Part E, they're simply confirming that they have completed a pre-course activity that outlines when ethics approval may be needed for a project and encourages obtaining patient consent proactively if they plan a case report. The second required assignment is due to me at the end of the placement. Students are asked to use one of their learning goals and associated achievements as the basis for a learning record and an implementation record for their continuing competence portfolio. If they are licensed with the Alberta College of Pharmacy, then they will follow that process. But if the student prefers to submit to a jurisdiction outside of Alberta, that is an option available to them. This assignment is just a way to engage the student in the continuing competence program that all professionals must maintain. The preceptor's role in this assignment is quite minimal, so this is more just for your awareness. As previously mentioned, all other placement activities are chosen through discussion between the preceptor and the student. As a preceptor, please identify possible assignments that allow your learner to develop the knowledge and skills that are highlighted in their learning goals, and also fulfill course objectives. Additionally, I encourage you to think of assignments that add value to the practice, the site, or the profession. Students appreciate being involved with projects that have value and are authentic to the type of practice that they are immersing themselves in. If possible, please provide your learner with ideas while he or she is preparing their placement proposal. That way they can be incorporated into their learning goals and associated activities. One other note is that students in the PharmD for Practicing Pharmacist program participate in a poster presentation in a different course within the seminar series. Hence, if a project or a case lends itself nicely for a poster, we encourage them to consider using it for that seminar. As mentioned earlier, they've already completed a pre-course learning activity that should have introduced them to the ethical considerations when potentially engaging in research or scholarship or a case report. All of the Pharm 515 assessment forms are electronic and are completed online. They're housed in the core ELM system, which was previously known as RX Preceptor. The midpoint assessment is completed after 120 hours, or the third week if it's a regularly scheduled placement. And the final assessment is completed at the end, after 240 hours. Both assessments ask the same questions and focus on the educational outcomes of the course. The midpoint is a formalized opportunity to provide formative feedback, whereas the final assessment is summative and you will be asked to recommend a course grade. There are 3 different types of assessments depending on the type of 515, whether it be focused on patient care, non-direct patient care, or a combination of both. For patient care placements, you'll be provided with Assessment Form A. The educational outcomes you'll be asked to assess are 3 in professionalism, 2 in communication, 3 in scholar, 6 in care provider, and 1 in collaboration. For non-direct patient care placements, you will be assigned Assessment Form B, where you'll be asked to assess 3 outcomes in professionalism, 2 in communication, 4 in scholar, 1 in collaboration, and 1 in advocacy and leadership. For combination placements, the outcomes are, again, 3 in professionalism, 2 in communication, 3 in scholar, 5 in care provider, and 1 in collaboration. For each outcome, you'll be asked to rate your learner based on the following scale: exceeds an acceptable level of performance, meets an acceptable level of performance, needs improvement to reach an acceptable level of performance, or not meeting an acceptable level of performance. If the student is meeting the expectations, meets an acceptable level of performance is an appropriate rating. Please save exceeds an acceptable level of performance for when the student really is showing exemplary skills, knowledge, or attitudes. If your student is close to meeting the expectations, but they need some improvement, then you can use the needs improvement. And not meeting an acceptable level of performance is really used for when you really feel like, even with a lot of work, your student probably is not going to meet the acceptable level. If you're finding that your student is not meeting an acceptable level of performance in several outcomes, please reach out to me, as I would like to talk with you about it and perhaps support the student and provide them with additional support to refine their learning plan and make some additional learning goals. There's 2 other ratings: unable to rate and not applicable. For unable to rate, this is an appropriate rating to use at midpoint if your student hasn't yet had the opportunity to engage in the behaviors or skills associated with the outcome, or perhaps you just haven't had a chance to directly observe it yet. It should be a signal to focus on this outcome for the second half of the placement. For not applicable, please only choose this if it's truly not applicable to your setting. Some outcomes may mention things like the ability to teach others or being able to apply the principles of scientific inquiry. Although at first glance it may seem like these are not applicable, I encourage you to really think about whether they could be applicable. So for example, maybe your student hasn't really been involved in very much formalized teaching, but think about how your student presents information to enable others to understand. For example, perhaps your student had to present some research data to their co-investigators. Was the student effective in teaching the panel the information? And for scientific inquiry, this may not be very applicable outside of a research placement at first glance, but think about it: hypothesizing or seeking out scientific explanations or postulating a strategy to find scientific rationale is something that pharmacists do in a variety of settings every day. To access the student assessment forms, you'll need to log into your Core ELMS account. As previously mentioned, it used to be called RX Preceptor. The website is there for you on this slide, and that's what the login screen looks like. Once you've logged into Core ELMS, you can access the assessment forms by clicking on Evaluations and then Evaluation of Student from the drop-down menu. If you want to learn more about your student in advance of the placement, you can click on Scheduling from the left-hand menu and then rotation schedule from there to learn more about your student. Very briefly, I'd like to go over some general preparations as you prepare to precept. If you haven't precepted before, you can access a variety of resources from our website. There are some preceptor training modules available for you if that interests you, and the options are here with the links. If needed, you can also review the course syllabus. It's a somewhat general document, but you may find it helpful. There are many additional resources available on our website, such as the precepting manual and various podcasts. Finally, preceptors with the U of A PharmD program are eligible for 4 months of university library access around the time of precepting. You can sign up using the link here. If you've precepted several times before, you're actually eligible for an academic appointment and title of clinical academic colleague. Again, the details are available at the link here on this slide. Remember that your student will likely reach out to you approximately 4 to 6 weeks before the placement for input and feedback on their placement proposal. Other important preparations include considering workspace. If your student will be mostly at your site, identify some dedicated space for them. Given the pandemic, your student may be working remotely. If this is the case, I encourage you to find a strategy for the student to check in and check out each day. Perhaps a Google Doc or something like that may be helpful. Think about if your learner will need IT access or a swipe badge, and if so, please discuss this with your site administrator to make arrangements. Also, please remind your coworkers and leaders of the dates that the student will be on site. I strongly suggest that you plan ahead to arrange your schedule such that there are opportunities for you to have discussions with your student and be able to provide them with feedback. If off-site, you can use Zoom or a different conferencing technology that suits your site. When providing feedback, try to be balanced. It's important that you talk to your student about what they are doing well so that they know what to keep doing, as well as discussing opportunities for improvement. Having time in your schedule to actually observe and spend time with your student is essential to inform the assessments. Thanks very much for your commitment to pharmacy students and to precepting in your practice. If you have additional questions, please feel free to contact me, and I'm happy to connect with you over email or phone, or to even schedule a Zoom call if you'd like to discuss. Thanks very much.